Health workers rely on personal protective equipment to protect themselves and their patients from being infected and infecting others. However, since the outbreak of the COVID-19 pandemic, shortages of these PPEs are leaving doctors, nurses, and other frontline workers dangerously ill-equipped to care for COVID-19 patients due to limited access to supplies. As a result of this, the Abosomankotere Cooperative Credit Union has donated personal protective equipment worth over 100,000 Ghana cedis to the Bono East Regional Health Directorate for onward distribution to 31 hospitals and allied health institutions within its catchment areas. Mr. Afobu Prosper is the CEO of the credit union.
When the pandemic hit the world, we thought it as a duty, as one of the pillars of the cooperative that's giving back to the society, to donate these items worth over 100,000 Ghana cedis to help the government, the traditional council, and the hospitals in our catchment areas to actually help fight the pandemic. We are donating these items to about 31 health facilities, and we are sharing the items according to the strength of those facilities. Of course, some are secondary hospitals, others are maternity homes, others are clinics and CHIP compounds. So we are going to share the items based on their strength and their needs. We did needs-based assessment before we acquired these materials.
Regional Health Director Dr. Fred Adumakon indicated that the Holy Family Hospital has been earmarked to respond to severe cases, adding that the region is working with all health institutions as a unit.
One of the ways that we are trying to fight this COVID-19 is to fight against it as a region, not as an individual facility. So that is the plan that we have put in. And because of that, we have designated some facilities that will see moderate cases. We are not going to allow almost every hospital to be seeing cases of COVID-19. No. If you do that, we have challenge in with the PPE. So as a region, Holy Family Hospital have been assigned as a facility that will manage the severe cases. And because of that, they will need much of the PPEs. We also have some facilities that we have earmarked as what? As the facilities that will see what? The moderate cases. But the key thing in fighting this COVID-19 is organization and working together as a unit.
On his part, Bono East Regional Minister Honorable Kofi Amakohene applauded the union for its support and called on corporate bodies to do same.
I think it's been a very remarkable thing that Abosomankotere Credit Union have done, and I think we do appreciate it so much. In fact, it's been the first of its kind, and I believe that we would need more. And I'll use the same opportunity to plead on to the corporate Bono East to respond to their social call, because this is the time that we need their assistance.
Mr. Afobu Prosper, however, has a plea to the general public on the need to desist from spreading falsehood, adding that precious lives will be lost if care is not taken.
Just last week, a friend of mine lost his wife, who was a chronic asthmatic patient. When he was taken to a facility and he had an attack, all the health professionals were running away because they said, I didn't be. By the time they sent her to the regional hospital, he has already expired. So you could see. So if care is not taken, and if you don't sanitize the airways, before you realize, we are going to lose a lot of precious life who may not be suffering from the COVID-19. So I think that the airwaves needs to be sanitized.
Reporting for Joy News, Anas Sabit, Tishiman.